Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people, or are you doing this to make money, or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews,
11 Alive News Primetime on the ATL starts now.
10 days, 15 days. By the time they get those test results back, they've already infected hundreds of people without knowing it.
Next on Primetime, even as the state sees record testing numbers, some Georgians say they have anxiously been awaiting results for more than a week after being exposed.
Toilet paper, flour, other household items still missing from some store shelves, when you can expect them to return and what to do in the meantime.
First tonight, a big step in sparking Georgia's economy. The Simon Property Group announced that it will open all 7 of its Georgia malls on Friday after Governor Kemp's stay-in-place order is set to expire. According to an internal memo obtained by CNBC, the malls reopening Friday include Lenox Square, Phipps Plaza, and the Mall of Georgia. It will all be up to the individual stores to reopen. All employees will have to wear a mask and be encouraged to take frequent breaks to wash their hands. As for shoppers, CDC-approved masks and hand sanitizing packets will be made available. Simon will have free temperature testing available as well and is encouraging retailers and other tenants to use technology for contactless transactions. 11 Alive's Chanu Hur spoke with one employee at Lenox Square who says reopening Friday is too early.
In just a few days, Lenox Square and Buckhead won't be empty like this.
Sorry, I'm just really frustrated about it.
Maggie Fincannon strongly disagrees with Simon Property Group's decision to reopen 49 of its stores starting this Friday, including 7 in Georgia. She works at the Van store at Lenox.
There are so many people that do want to go back to work, that are relying on going back to work, but I just don't understand. It's too soon. It is.
She says even with safety measures the mall plans to take, Maggie says she's not going back to work at least through the month of May.
It's not like a visible physical threat. So I just don't know how they're going to enforce what they're going to try to enforce.
She's taking COVID-19 seriously and isn't shy from voicing that because it's impacted her life. In a tweet, Maggie says, my roommate tested positive for COVID last week, and my mom, don't live with her thankfully, is a healthcare worker over 60. It's impossible to not think of how this affects others.
I just know that there's so many people that are so strongly affected by it that it's not worth it.
She thinks there's no price tag on people's health and safety.
Honestly, the mall is so unessential. I feel like it should be one of the last things that open. Retail should not matter right now. Money shouldn't be prioritized over people's health.
Well, we want to know, do you think it's a good idea to reopen Georgia's malls on Friday? About right now, 84% of you saying no, you don't think it's a good idea. 16% saying yes. You can vote right now in our live poll on 11alive.com/vote.
Coronavirus has been described as a silent killer. There is more information that it was spreading in our community well before it was officially on the radar in early March. With each passing day, experts learning more about the virus and who it is hitting particularly hard in Georgia. But if you follow the numbers, you have seen dips and climbs and the ever-changing projections. Joe Henke explains why the number of cases and deaths seem to be pretty fluid right now.
Social epidemiologist and data policy analyst with the state previously.
Dr. Colin Smith is a professor with Georgia State University's School of Public Health. As the state collects more information on COVID-19 and updates how it presents the data, there's a growing number of confirmed cases listed for January, dozens in February, and even COVID-19 deaths in February.
Early in an epidemic, you're going to see a number of causes of death or cases being missed. They'll be misdiagnosed as other things. As we move through the process, what you'll have is folks going back and looking at previous deaths or previous diagnosed things.
The state DPH has really done a good job of getting data together, updating the presentation when it's warranted to provide a more comprehensive picture.
Dr. Robert Bednarczyk is an assistant professor of global health and epidemiology with Emory University. He says in a short time, the state created a still evolving system for presenting 159 counties worth of data.
It is important that as we go through that we do keep a critical eye on the data that we have available and what other data we may be able to get.
Bednarczyk says he would push for more information, though, about the race of patients. The majority of cases are listed amongst African Americans, but 31% of cases still have no race listed.
Even with that, we are seeing a preponderance of disease among the African American community. And, that I think, does look at maybe some underlying health disparities and access to health care.
Smith agrees and goes a step further.
I really like to see it by race and sex combined, and potentially also by age group. So we can get a better idea of how the disease is impacting specific segments of the population.
Governor Kemp is sticking by his statement that overall state numbers support his decision to give some businesses the option to reopen. The governor says he recently had a good call with the president. You might remember last week, the president was critical of the timing of Georgia's reopening.
We're moving forward with data and information and decisions from the local public health officials, meeting and working within the guidelines of the great plan that the president has laid out, and you're seeing many other governors do that as well.
Yet the state numbers still show an about 23% increase in cases and a 26% increase in deaths since last week. It is important to point out that more testing means more cases counted. Today, the state reported a new record for testing. The governor says nearly 13,000 new tests were reported to DPH. That's the largest single-day increase since the outbreak started. The state has promised speedy results, but Caitlin Ross spoke with one family still waiting for results more than a week later.
It's very frustrating. My dad has COPD, CHF, he's diabetic, and he has renal failure. And if he has this, then he's not getting any kind of care for it whatsoever.
This caller wants to remain anonymous, but says her father is a patient at Calhoun Healthcare Center in Gordon County. So far, 21 residents and 7 staff members there have tested positive for COVID-19. 4 of the residents have died, but she says she still doesn't know if her dad has the virus.
It was the 18th, the National Guard came in and they tested all patients there. And as of this moment, we still have no test results.
That's 10 days they've been waiting. In a news conference yesterday, Governor Brian Kemp says a partnership with Augusta University and Georgia State is increasing testing and returning results in 72 hours.
Our testing numbers are quickly increasing, but we realize we have to continue to do more. As of this morning, Georgia ranks 13th among states and territories in the total number of tests. And for per capita testing, we are now 36 overall.
The state announced a plan to increase free public testing starting today, but this worried daughter just wants the results of the test her dad already took.
By the time they get those test results back, they've already infected hundreds of people without knowing it.
Well, we want to include your voice in the conversation about coronavirus testing. Call us and leave a message at the number on your screen, 678-765-9514, to tell us about your testing experience. Make sure you leave us your name, where you're from, and the best way for us to reach you. We might include part of your message on air.
Your 11 Alive Storm Trackers want you to be weather aware on your Wednesday and have a safe shelter if necessary, because we're going to have some thunderstorms, some of which could be severe on our Wednesday. So you can see right now just a few little showers across North Georgia as our atmosphere is starting to moisten up. We have a southerly flow, so that's going to take our relative humidity and our dew points up during the overnight hours. The main frontal system is well out to our west here, stretching from the Great Lakes down into Oklahoma, into the Central Plains. Tornado watch along that frontal boundary. Also numerous severe thunderstorm warnings and a couple of tornado warnings as well in those little smaller red polygons there. So they have a level 4 out of 5 levels risk of seeing severe weather tonight, especially in eastern Oklahoma and in northeastern Texas. And this whole area is going to be shifting towards us. Now, we don't expect to have a level 4 chance for severe weather here, a risk, but we do have a level 2, and that means we could have somewhat organized severe storms, a squall line possibly that could spawn an isolated spin-up tornado. We could have some large hail as well as some gusty damaging winds as this line makes its way on through. So tonight you don't need to worry about it. That's the only good thing about this. It won't be coming during the overnight hours. It'll be a daytime system with that level 2 threat all across North Georgia and into middle Georgia tomorrow. We'll start out with a few showers during the early part of the day, and then thunderstorms during the afternoon will start to become more organized. We'll likely see a line moving out of Alabama by late in the afternoon and then into the evening hours as well. So coming up, we'll go hour by hour and let you know which impacts you can expect where you live.
Health officials in Hall County say they are trying to stop an uptick in COVID-19 cases. The county is emerging as North Georgia's COVID hotspot, though it's still well below levels seen in southwest Georgia counties surrounding Albany. 11 Alive's Doug Richards takes a look at what is happening there.
At Northeast Georgia Medical Center in Gainesville, workers created a temporary unit to expand the hospital's COVID-19 capacity. Health officials say at least some of those patients are coming from the area's chicken processing plants. The plants are an economic engine for the region and normally a source of pride. Now they're also part of a pandemic.
Workers didn't have masks. I think the whole community didn't have masks.
Vanessa Ceruza is with the Gainesville-based Hispanic Alliance of Georgia, a community that powers much of the workforce in chicken plants.
This crisis has really come at us in a rather quick way, and if you're used to doing certain things in a poultry plant, it was just hard to adjust kind of the workplaces to what needed to be adjusted.
State data released at midday shows that Hall County has the highest rate of COVID-19 cases in North Georgia, including the rest of metro Atlanta, with 544 COVID cases per 100,000 population. That's twice the rate of Fulton County. 16 other counties have higher COVID rates. All of them are in southwest Georgia. The man on the left is John King, Georgia's insurance commissioner and a native of Mexico. He visited Gainesville's Fieldale poultry plant Monday. He says poultry plant workers
really have a hunger for actually having accurate, verifiable information that is in their language that they could understand. They don't know who to trust.
We had, 300 of people show up for a free test. Well, more than half were actually positive with no symptoms.
The good news in Hall County is the COVID-19 death rate is low relative to other hotspots, with healthcare workers geared up to treat it.
All right, coming up, small business loan delays have been a source of frustration for entrepreneurs and business people everywhere. We will have the very latest update for you.
And don't forget, we are streaming all 3 hours of Primetime on our 11 Alive YouTube channel. Make sure you subscribe and join in on the conversation in the community section. There's more 11 Alive news in Primetime after the break.
This email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
For the second day in a row, technical issues are delaying thousands of small business owners from receiving coronavirus relief loans. Banking industry groups say the SBA's loan processing system is still unable to handle the increased volume of loan applications. The applications are being filed by thousands of business owners trying to get aid under the Paycheck Protection Program, which is part of the government's $2 trillion coronavirus aid program. According to the SBA, the slowdown is due to its attempts to limit the amount of loans one bank can submit at a time. Coronavirus relief loans are designated for small businesses, which is why some people were confused to find out the Los Angeles Lakers not only qualified, but they received over $4 million in aid. The NBA team employs fewer than 500 people, which meets the requirement of the U.S. Small Business Administration to receive aid from the coronavirus relief package. However, once they found out the funds from the program had been depleted, team owners decided to direct the loan to those most in need. 11 Alive's financial contributor Andrew Polis says it is a loophole that needs to be fixed.
Since I've had under 500 employees, so I think that's where a lot were able to get through. If it was up to me, and the brief that I sent to Congress last week, publicly traded companies have access to resources that small businesses don't. They should have been prohibited to begin with.
Well, there was a lot of backlash, as you might imagine. 13 companies, including Shake Shack and Ruth Chris Steakhouse, have returned a total of $98 million to the government.
Toilet paper, cleaning, disinfectant, baking supplies. A few months ago, if those items were on your list, you were pretty much good to go at any store. But since those stay-at-home orders went into place in March, they're nearly impossible to find. So when can we expect to see them back on our store shelves, and what can we use as replacements in the meantime?
Let's start with disinfectants and wipes. Expect to see those in June or July. Both of the major makers, Clorox and Lysol, so they are ramping up production as much as they can. But because a lot of the raw materials for these items come from China, which was hit hard by the virus and had shutdowns too, there's a trickle-down effect happening. Good news, stores are still receiving shipments in small spurts. The CDC also says you can use alternatives like hydrogen peroxide or bleach with water. Next, hand sanitizer and toilet paper. After weeks of empty shelves, it's starting to show up more regularly in some stores across the country. That means there are some available, but in limited quantities. Baking needs like flour and yeast have also become hard to find as more people take up baking while stuck inside. Check with local restaurants and bakeries as many are selling off the products. For example, Rumi's Kitchen in Sandy Springs has launched Rumi's Pantry. Panera has set up an online ordering system to buy its fresh fruits and veggies and dairies. And Hodgepodge Coffee is selling bread flour curbside. Another item missing from a lot of store shelves, diapers. Expect to see these in the high quantity variety we're used to in 6 weeks to 2 months.
I'm meteorologist Samantha Moore, one of your 11 Alive storm trackers, and we are looking at a really nice evening before all of these storms roll in tomorrow. Excuse me, I'm trying to get everything neatened up for you here. I'm from my home studio tonight, so I just have to get the cursor in the right spot. Notice the clouds on the increase here in Newnan. This is our live tower cam there of the historic courthouse. The winds have died down. It's a really nice night. In fact, it's hard to believe that we're going to see conditions go downhill tomorrow. So today was 78 after morning low of 53. We should be around 76 and 55 this time of year. So we were just a couple of degrees above for our high temperature, couple of degrees below for our low temperature. Looking at the radar, you can see just a few little light pesky showers across far north Georgia. A lot of this isn't even hitting the ground yet, but we're going to see the atmosphere moistening up overnight. Notice that southerly flow. That's going to bring our relative humidity up, our dew points up during the overnight hours, and that will provide some fuel for those thunderstorms tomorrow, some moisture. So as we look out over the plain states, this storm is looking pretty nasty tonight. This very well-defined frontal system, tornado watch box, and the big red box there, those little yellow boxes are all severe thunderstorm warnings, and we've had numerous tornado warnings along that line as well. And there's also a line out well in advance of this that did a number on much of Louisiana today as it moved on through. No current warnings now, but there were for much of the day. So tonight, no worries. You can rest assured that there will be no storms overnight. So the good thing about the system is that it will be coming during the daylight hours. But overnight tonight, we'll end up seeing those clouds start to thicken up a bit, temperatures in the low 60s. Tomorrow, the day starts out pretty nice for that early morning walk or run, and then we'll see the chance for storms going up after lunch and during the evening hours. And so we'll be watching that whole area of severe weather, which tonight is in that moderate range, that level 4 out of 5 range. So they're really going to be seeing some nasty stuff in and around the Arklatex tonight. This shifts to the east tomorrow, weakening as it gets to us. However, we still have that level 2 risk, which means that we could see some numerous severe thunderstorms, a little more organized in nature than they would be if we had a level 1 risk. And we could likely see some damaging wind gusts, trees coming down, heavy downpours, some hail, as well as some spin-up tornadoes. And it's really pretty much the entire state is in that level 2 risk. Almost all of it. Southeast Georgia is not. They're in the level 1. But our severe threats then, we have a medium risk for the gusty damaging winds, the heavy rain, and the hail. We could see hail as large as quarters. A fairly low risk for tornadoes, but we can't totally rule it out altogether. So we need to be weather ready and able to seek safe shelter should a warning be sounded in our neighborhood. So as we head into the overnight hours, notice how we'll have the clouds thickening up. Those thunderstorms move into Carrollton and Marietta after lunchtime. Then mid-afternoon, Marietta into Carrollton, Peachtree City between around 2 and 4 o'clock in the afternoon, and right across Atlanta between around 3:30 and 5 o'clock. And then that heavy stuff moving into Athens and Eatonton perhaps right around dinner time. And then just a few wraparound showers on the backside of this on our Thursday. So no big deal. Once we get to Thursday, it will be drying out, and then we'll be set up for a very nice weekend. So we have that 90% chance of showers and storms on our Wednesday that could be severe. They taper off on Thursday, and then we see a beautiful weekend, 11 Alive Day on Friday, and warming into the 80s for Saturday and Sunday.
ATM.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid.
There has been a lot of talk about testing for COVID-19. And there has been a long way, a lot has been accomplished since January, but state and federal leaders calling for more testing. And now we are seeing more talk of antibody tests as a faster alternative to testing for the virus and the possibility of immunity. We've had our Verify team talking to experts to break down the testing and how it works. Here is our Jason Puckett.
There are a lot of tests for the coronavirus. The FDA has a list of 50 approved and about 115 more that are being reviewed. And they use a lot of different methods to get a test sample. There are nose swabs, finger pricks, blood samples, and more. So what's the difference with these tests? We brought in Dr. Michael Borowitz, the Executive Deputy Director of Johns Hopkins and the Laboratory Director of Johns Hopkins Hospital.
There's really two fundamentally different kinds of tests that tell you different things.
The first is the molecular test, or what most people think of as a COVID test. Most commonly, they use a nasal swab deep in your sinuses to get a sample. The sample is then tested for the actual virus itself.
Molecular tests, the tests that actually look for the RNA of the virus, are analytically very accurate.
The benefits of this test? According to Dr. Borowitz, it's the only definitive way of knowing if someone currently has the virus and whether they're contagious. The negative, it's a little slower, typically taking about a day for results. The second type of test is the antibody test. It's a quick turnaround test, results in minutes. Instead of testing for the virus itself, these tests look for antibodies your body made fighting the virus and the potential for plasma development used in treating the symptoms of COVID-19. But it has its limitations too.
It doesn't tell you just because a patient has an antibody that he's necessarily immune to the disease. That's what everybody wants to know, but that hasn't been proven.
And it can't tell you whether you're actually over the virus.
You don't know for sure when you have somebody who has antibodies is whether or not they're still infectious. So if they've had the disease and they've developed antibodies, they may or may not still be infectious.
So basically, the molecular COVID tests tell you if you have the virus. The antibody tests tell you if you've had it. And Dr. Borowitz believes as antibody testing continues to develop, there's potential they can do more.
If we ever get to the point where the results of those tests are not only telling you exposure, but also telling you immune status, then they become extremely important, because then at that point, you can start using them for making decisions about how you manage people.
If you've got any other questions for us to look into, send us an email.
Still ahead, our Reveal investigators visited grocery stores across the metro to see how well customers and employees are following guidelines meant to keep them safe. The results are in next on Primetime.
You are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11 Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when
Your 11 Alive storm trackers will be tracking a chance for severe storms on Wednesday, and that's why we have a 5 on your wasometer. Of course, that wasometer scale goes from 1 to an 11, with an 11 being a perfect day, so not the greatest of days, with a 5 on the wasometer and a chance for strong to severe storms developing during the day. And that's the only plus side to this, I guess, is that it'll be during the day, and it will not be an overnight system when everyone's trying to sleep, and it can take you by surprise. So everyone needs to be weather aware tomorrow and ready to seek safe shelter if needed. We have that medium risk of gusty damaging winds, could see some limbs and trees down. We have a medium risk for some flooding, some heavy rain, and a medium risk for some large hail, a low risk for tornadoes, but we can't rule out some spin-up tornadoes. We've already seen numerous tornadoes along this line today, and that is the frontal system that's moving in our direction. They have a tornado watch out right now for much of eastern Oklahoma and numerous severe warnings, as well as a couple tornado warnings. And there's a line out ahead of it as well that's been bringing severe weather to much of Louisiana today. So this is what is heading in our direction. It is a level 4 out there over the Central Plains as it moves towards us. We do expect it to weaken somewhat, but still a level 2, so still capable of bringing in a lot of wind damage and some isolated tornadoes, especially during the evening hours. So we'll be talking more about the timing of that coming up. And I just maybe want to talk to your kids tonight about where you live, what county you live in, and where are the counties to the west of you, because this system is moving from west to east. So you need to know the counties due west of you in case those counties are warned on, so you can seek safe shelter. We'll have more on the timing of this coming up.
Sam, thank you. Georgia's shelter-in-place order is set to expire after Thursday, and while Governor Kemp says the numbers support lifting some restrictions, he hasn't made the decision whether or not to extend that order. Tonight, researchers warn that even lifting restrictions gradually over the next month could mean a second wave of new infections in the summer. Owen Lopez has the story.
We are expecting this spike to come in about 2 to 3 months after the restrictions are lifted.
Turgai Iyer, a health systems engineering professor at Georgia Tech, has collaborated with Harvard and others to develop a COVID-19 simulator, which predicts a second wave of COVID-19 cases in Georgia this summer based on easing restrictions.
It's very easy for this virus to accelerate and spread in the community, but it is very difficult, as the WHO director said, to decelerate the spread in the absence of pharmaceutical interventions.
The simulator estimates Georgia will see more than 23,000 deaths by August if restrictions were lifted in 4 more weeks. If restrictions are kept in place for 12 more weeks, the number of projected deaths drops to 1,940. Iyer says a second wave of cases could not only affect public health, but the economy as well.
If we go through a second wave and if the cases increase significantly as we project based on our model, there is a good chance that we may go back to what we are experiencing now. We may go back to these restrictions.
Iyer says part of his concern with easing restrictions too soon is that it could lead people to believe things are back to normal, lowering public awareness, which could lead, he says, to an uptick in cases.
Dozens of grocery store workers nationwide have died from COVID-19. Many of you have asked us how safe your grocery store is. Are workers required to wear masks? And who is enforcing the rules? Our chief investigator, Brendan Keefe, has a video showing a wide range of policies and practices.
Grocery store workers come face to face with the virus every day. This is the only place where every American is allowed to go, with workers who must interact with hundreds of people every day.
Before this, grocery store workers were largely taken for granted. You're now universally seen as the heroes keeping the supply chain going.
The reason I'm doing this isn't because I want to be a hero. It's because I am trapped here, because we can't quit and get unemployment, and we're not going to get fired. We are forced to be there. We are forced to be exposed.
The CDC recommended everyone wear face coverings in grocery stores and pharmacies starting on April 3rd. It took another 17 days for Walmart, Publix, and Atlanta area Kroger stores to require their workers to wear masks. Before the policy changes on April 20th, it was a choice the workers had to make for themselves, even when handling food.
We recorded openly using our phones while shopping in multiple grocery stores over a 2-week period, but only while shopping for necessities we needed ourselves.
At this Kroger in Johns Creek, the week before the company required masks, the worker collecting the carts wasn't wearing one. There was no one sanitizing the carts when we arrived.
Is there nobody wiping them?
We found the same thing at this Kroger in Alpharetta. In both Kroger stores, there were spray bottles, but empty paper towel rolls next to the carts. This cashier at the Johns Creek Kroger was wearing a mask before Kroger required them, but look closer at his hands. Those gloves are ripped as he touches every single item. In the produce section the same day, a worker with no mask touches her head to adjust her glasses with an apple in her hand before putting that apple out for sale.
Save that money.
We went back to the Johns Creek store the first day Kroger required masks and found an employee with her mask under her chin while talking with another maskless employee. Another one with a mask and one without in the deli food prep area. The cart guy had no mask on Monday. Then on Tuesday, the cart collector had a mask but touched his head before pushing the carts with the same hand. This Publix in Buckhead has one-way aisles and encourages social distancing among customers, but not all employees were following those same recommendations. But all carts were sanitized. Publix says it has updated its protocol as the CDC guidance has evolved. We spotted employees socializing at the Suwannee Walmart the first day the company required masks. We didn't see anyone enforcing the mask rule, but we did see several employees stocking shelves and handling food with their masks on their chins, under their chins, or completely missing.
Sorry, I don't want to get too close to you.
Even after Walmart instituted its mask policy, this worker without a mask was stocking the produce shelves. Walmart does have a shield between the cashier and the customer, but we spotted 4 checkout lanes open right next to each other out of 7 possible lanes, which, like the Buckhead Publix, puts workers right next to customers in the next lane with no barrier.
You guys are all out of hand sanitizer, right?
Target has not yet required its team members to wear masks at all. We spotted an unmasked worker stocking the produce shelves at this Suwannee Target, where most of the checkout personnel were also mask-free, which is still allowed. The carts were all sanitized, however. Target says it has expanded rigorous cleaning routines to keep guests and team members safe.
Every time you come into the store, you are endangering us. And of course, you need to come once a week, twice a week for actual groceries. But for the people that are coming in because you have a craving for a chocolate bar, consider you need that chocolate bar so bad that you're willing to put hundreds of people's lives at risk.
At grocery stores all over Metro Atlanta, we saw used gloves discarded in the parking lots. Gloves a worker will eventually have to pick up.
Kroger responded, "We are working with store managers and associates to address the issues you identified, and we encourage customers with concerns to reach out to us." Walmart wrote, "We are taking steps to ensure our area stores and associates are clear on the changes so this doesn't happen again." The full statements from Walmart, Kroger, Target, and Publix are available right now on 11alive.com.
Add Delta to the list of companies updating their policies on protective equipment. The airline says it's making changes to its guidelines starting today to help with the spread of COVID-19. Our Nick Sturdivant breaks down what this means moving forward.
I'm at Hartsfield-Jackson International Airport, where starting today, Delta Airlines told me this morning that employees will have to wear this, yes, face masks in cases where they can't stay at least 6 feet away from others. This is the memo Delta sent me this morning. In it, the airline says the requirement is temporarily in place until at least June 30th. It also says it will make masks and face coverings available to employees, and they are free to use their own face coverings too. Delta says this new requirement applies to all public work areas, including break rooms and lounges, with exceptions for certain situations depending on the worker's role. The airline also strongly encouraging customers to wear masks and says it will make them available at ticket counters, gates, and onboarding airplanes. This comes as JetBlue announces a stricter policy. Starting May 4th, if you fly with them, you will have to wear a face covering. Its employees, just like Delta and American Airlines, will also be required to wear one. And just to reiterate, according to Delta, this requirement to wear face coverings will temporarily be in place through June 30th.
This is a sad story that we've learned today. Family and friends and fans across the nation are mourning the loss of Atlanta reality star Miss Minnie. Ashley Minnie Ross died following a car accident on Old National Highway on Sunday night. According to police, she hit a curb, crossed into the northbound lanes, and then struck a Ford Focus head-on. Ross was taken to the hospital. She later died. The driver of the Ford Focus sustained minor injuries and was treated at the scene. Ross is best known for her appearance on the hit Lifetime reality show Little Women Atlanta. Her team described her as the most beautiful, kind, giving, generous human being ever, and she was only 34.
Wow. Minnie.
Ahead, the president says the U.S. Postal Service is a joke, and he doesn't want it to get any relief money. Next on Primetime, a closer look at the fight over raising package delivery rates.
When you are sick, cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11 Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97. Are you doing this to help people, or are you doing this to make money, or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when
The coronavirus is taking a toll on the United States Postal Service, expected to cut mail deliveries in half. But the president is pushing back on federal aid for the agency. He says he does not want to put money towards the USPS unless it raises its rates.
The Postal Service is a joke because they're handing out packages for Amazon and other internet companies, and every time they bring a package, they lose money on it.
This is a complicated issue that needs some context about how the Postal Service works and why it's asking for federal money. Here's Stephanie Simmons.
The United States Postal Service is currently all over the news. Some believe it's an outdated and underused government agency that should be broken up and privatized. Others say it's an important public service that guarantees inexpensive daily mail and parcel delivery. As the political debate over its future rages, here is what you should know about the U.S. Postal Service. The USPS employs over 600,000 Americans in all 50 states and territories. It operates over 31,000 post offices everywhere from New York City, population 8.3 million, all the way to Adak, Alaska, population 386. It has a fleet of 228,000 vehicles, which drive 230,000 daily routes, where mail carriers deliver an average of 142 billion letters and parcels per year. Finally, even though the Postal Service is a government agency, it uses zero tax dollars. They operate solely on revenue from their postage, products, and services. In the midst of the pandemic, the USPS has requested $75 billion in cash, grants, and loans in order to keep running. The USPS hopes the injection of cash will ensure its survival through the pandemic and beyond.
Well, the Postal Service was losing money even before the pandemic. The agency has lost $69 billion over the past 11 fiscal years.
Clouds are on the increase this evening as we take a look at the live tower cam coming to us from Blue Ridge. I was watching those clouds increase. Of course, the sun is set now and it's getting darker. And everyone should be prepared for severe storms tomorrow, whether you live in Blue Ridge, Carrollton, Eatonton. Everyone needs to be ready to seek safe shelter if necessary. We have a level 2 risk. And right now, just a few little pesky showers out there moving across North Georgia, but that'll continue to moisten up overnight and we'll see more widespread rain during the day tomorrow. But that line that's going to bring in our main threat for severe storms is still out over the Mississippi River Valley, stretching back into the Central Plains. Tornado watch along that boundary right now, as well as some tornado warnings and numerous severe thunderstorm warnings. And a line out ahead of it, too, that's going to be working its way to the east tonight, and that had numerous tornado warnings on it today as well. So right now, temperatures have warmed up nicely. Today we were at 79 in Atlanta, 76 in Carrollton, 79 in Marietta, 81 in Rome, Athens, and in Thomaston. Already in the 80s and more 80s coming as we head into the weekend. But for tonight, temperatures getting down into the 50s. We'll see those clouds on the increase overnight. And then tomorrow, I think it'll be a nice start to the day to get in that morning run or walk or bike ride. And then we'll see the storms moving in during the afternoon and evening. And I think they'll be at their peak right around dinner time to around 5 and 8 o'clock at night. So we'll have those storms on our Wednesday, some of which could be severe. We'll be seeing a dry pattern set in for the end of the week, and then it'll be heating up over this weekend in a pretty big way. There's that level 4 risk over Texas and Oklahoma tonight, and this area of storminess is going to be heading in our direction as we head into Wednesday. We do expect it to weaken somewhat as it moves in. However, still a level 2 risk, which for us means we could see damaging wind gusts, hail up to a quarter in size. Spin-up tornadoes are not out of the question, although that's a lower risk than the winds or the hail or the heavy downpours that we're likely to see. So just about all of North Georgia into middle and southern Georgia is under that level 2 risk. Far eastern Georgia is in the level 1 risk, a marginal risk. But here we will be watching for that threat throughout the afternoon and evening hours, particularly. I think that's when it's going to ramp up. So for tonight, we'll have those southerly winds moistening up the atmosphere. Tomorrow, a decent start to the day, and then that line moving in. This is 1:30, moving into Carrollton, heading into Troup County, maybe between around 2 and 3. This is 3 o'clock. That line extending from Blairsville down to Troup County, marching to the east through Atlanta by around 3 to 4 o'clock in the afternoon. So that's when we'll see the most intense storms, most likely. And then pushing off to the east, it looks like they may continue to strengthen. A little bowing here showing up on this future radar right around dinner time. So we'll be watching for the severe line to move through during the afternoon and evening, and then just a few showers on the backside of that on Thursday, but for the most part improving conditions, just a few light showers. So the rainfall amounts will be heavy in some spots where we get some really strong storms. Elsewhere, we're expecting to see around 1/4 to 3/4 of an inch. So we do expect to see on your Wednesday a 90% chance of showers and storms, 20% chance on Thursday, and that's just a few wraparound showers. And then we dry it out for the weekend, an 11 Alive day on Friday, and 80-degree temps for Saturday and Sunday.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11 Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97. Are you doing this to help people, or are you doing this to make money, or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
The Verify team is here to fact check the suspicious things you see online.
Well, I was very suspicious about the not only the check, but also all the directions.
Mary Arponte from Arlington, Virginia, has been a teacher for more than 30 years. But because of the pandemic, she says she's been furloughed. So Mary answered an online ad saying she could get paid for wrapping her car. But when she got this letter and check, she got suspicious and contacted us.
And the check was over $3,000, and I give $3,100 to the installer, the wrapper, and then I would keep the remaining monies.
First, we looked to the Federal Trade Commission. On their website, they explain how typical car wrap scams work. You're told to deposit a check and keep some for yourself. You're then told to send the rest to a specialist who will do the work on your car. But the specialist never shows up, and the fake check then bounces as they make off with your money.
They wanted her to cash this check to go buy her supplies. And that's a big red flag when it comes to employment schemes, because you should never have to, cash your check to then go buy a computer.
Our researcher, Eliana Block, called the number listed on the letter. She got hung up on twice. We also contacted the company name listed on that check. The CEO told us that they did not issue the check and they are no way affiliated with any car wrap company. So we can verify this check is not legit, and our researchers told Mary not to deposit it.
Well, if you have something you'd like for us to verify, send it to us on Facebook, Twitter, or email us at verify@11alive.com. Well, what has life been like for you? We set up a space for people here in Atlanta to share their experience staying at home, the good and the bad. Hear what people had to say next in Primetime.
This is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97. Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory.
We've all gotten pretty good at social distancing by now, but some of us really just want to have a conversation face to face. So our Crash Clark set up a safe, socially distanced place to ask you how you're holding up right now and what keeps you going.
Tell me what it's like at your house with family. But you got some kids there?
Right now we have a newborn baby. We have to really be cautious. Normally when you have a baby, a lot of family members will come over and try to help out. So we haven't been getting any type of help. It's very challenging, but we're making it through.
What keeps you positive?
First of all, that Jesus came and gave his life. And so in terms, I have to do that for those, especially in memory care, that don't have a voice anymore. I feel like I have been called to that part of service.
You know, we're where Atlanta speaks. Is there anything you want to say? Give a little more of that positivity.
There's always going to be that something. You just got to rise above it and just keep moving.
What are some of the things that are kind of lifting your spirit up a little bit?
So I'm in here buying bread because we're making sandwiches for the shrine down in the city, and they give out sandwiches to about 700 people every Saturday. You see the best coming out of a lot of people when things like this happen.
What do you want to say to everybody that's either staying at home or venturing out for a little bit of shopping?
I would say give yourself some grace. It's okay to have good days and bad days.
How are you getting through all this? What are you doing?
Well, I worship. And though these are difficult times, he's faithful still. This too shall pass. Troubles do not always last. It's a temporary thing. It's on itinerary, but it's not the final destination.
Life is bigger than what we thought it was. You know what I mean? The smaller things really count.
I want to encourage everyone to stay strong.
Trouble don't last always. Love that. Well, we always want to hear from you. Share your experience by emailing us at whereatlantaspeaks@11alive.com.
11 Alive News Primetime on the ATL starts now.
Next on Primetime, with Georgia nearing 25,000 confirmed cases, a new COVID-19 hotspot is emerging near Metro Atlanta, what experts say is behind the increase. And some of Georgia's busiest shopping centers plan to reopen by the weekend. What some employees have to say about the decision. Each day, more Georgia businesses prepare to welcome back customers, hoping to recoup some of what they've lost during the pandemic. Reopening hinges on some key points, though: increasing our testing rate and a steady decline in confirmed cases. Governor Brian Kemp stands by his statement that the numbers support that, yet data provided by the state still shows an almost 23% increase in cases and a 26% increase in deaths since last week. Important to note, state testing is up significantly, and that adds more cases to the count. The state numbers also show a new emerging hot spot for cases in the northeast Atlanta suburbs in Hall County. Officials say it's rooted in the area's chicken processing plants. 11 Alive's Doug Richards headed to Gainesville to speak with people there.
Chicken processing plants have fueled the economy of Hall County for decades. Now, officials say workers in the plants are driving Hall County to becoming a COVID-19 hotspot. Vanessa Ceruza is with the Gainesville-based Hispanic Alliance of Georgia.
We didn't have the luxury of staying home during this COVID crisis, but had to, hit the road running to go to work and continue, to work throughout this crisis.
State data shows Hall County has the highest rate of COVID-19 cases in North Georgia, with 544 COVID cases per 100,000 population. That's more than twice the rate of Fulton County. 16 other counties, all in southwest Georgia, have higher COVID rates. The man on the left is Georgia Insurance Commissioner John King. A Spanish-speaking native of Mexico, King visited a plant in Gainesville Monday. He says the chicken processors are motivated to keep plants open with healthy workers.
If a worker, is the temperature is high, they don't allow them into the plant, and they send them home with pay.
In Gainesville, the North Georgia Medical Center has set up a mobile emergency room to increase capacity for COVID patients in this newly emerging hotspot.
Tonight, there's a big step to reboot Georgia's economy. The Simon Property Group announcing that it's going to open up 7 of its Georgia malls. And this is after Governor Kemp's stay-in-place order expires. So this is what we know. According to an internal memo obtained by CNBC, the malls reopening Friday include Lenox Square, Phipps Plaza, and the Mall of Georgia. It's going to be up to the individual stores to actually reopen. All employees will have to wear a mask and encouraged to take frequent breaks to wash their hands. As for the shoppers, CDC-approved masks and hand sanitizing packets will be made available. Simon will have free temperature testing available and is encouraging retailers and other tenants to use technology for contactless transactions. 11 Alive Stu Her actually spoke with an employee who works at Lenox Mall, and she believes that the malls are opening up too early.
In just a few days, Lenox Square and Buckhead won't be empty like this.
I'm just really frustrated about it.
Maggie Fincannon strongly disagrees with Simon Property Group's decision to reopen 49 of its stores starting this Friday, including 7 in Georgia. She works at the Vans store at Lenox.
There are so many people that do want to go back to work, that are relying on going back to work, but I just don't understand. It's too soon. It is.
She says even with safety measures the mall plans to take, Maggie says she's not going back to work at least through the month of May.
It's not like a visible physical threat. So I just don't know how they're going to enforce what they're going to try to enforce.
She's taking COVID-19 seriously and isn't shy from voicing that because it's impacted her life. In a tweet, Maggie says, "My roommate tested positive for COVID last week, and my mom, don't live with her thankfully, is a healthcare worker over 60. It's impossible to not think of how this affects others."
I just know that there's so many people that are so strongly affected by it that it's not worth it.
She thinks there's no price tag on people's health and safety.
Honestly, the mall is so unessential. I feel like it should be one of the last things that opened. Retail should not matter right now. Money shouldn't be prioritized over people's health.
So we wanted to know, what do you think? Is it a good idea for Georgia to open up those malls by this Friday? And you have been voting on our website, 11alive.com/vote, and it seems like 84% of you say no and 16% say yes. This is more than 600 people voting tonight, and you still have an opportunity to weigh in because we want to hear from you. You can cast your vote on the 11 Alive app or, as I told you before, 11alive.com/vote.
I'm meteorologist Chris Holcomb from the 11 Alive Storm Trackers. If you're wondering why my phone is sitting here on this stand, I'm talking to about 700 people on Facebook Live right now. A lot of folks are interested in what is coming our way tomorrow with the storm system that's moving in. Right now we are dry. We've been tracking just a couple little sprinkles really up in parts of North Georgia. However, look at this system that is out to the west right now. That is a very impressive line of storms moving from Illinois into Missouri, back into Oklahoma, beginning to push into Arkansas. We have severe thunderstorm watches, a tornado watch, numerous severe thunderstorm warnings, and even a couple of tornado warnings there in southern Missouri, and now a bigger severe thunderstorm watch in advance of that system. Why do we care about this? Well, because it's moving our way. And you can look at the severe weather threat for tonight. Not in our area. It is out to the west, right where we're seeing those storms developing right now. In fact, that's at a pretty impressive moderate risk right there, level 4 of 5 risk for those storms out to the west. By the time the system moves in here, we don't think it's going to be as strong, but still, we have the potential for some strong thunderstorms to roll through our area. There is a level 2 risk, the yellow color that you see here, over North Georgia, Metro Atlanta, down into central Georgia, back into Alabama as well. That is that level 2 of 5 risk, meaning in these areas we could have some strong thunderstorms with damaging winds, hail, and maybe even a brief spin-up tornado, even though the tornado risk is on the low end. Stay with us. We'll talk more about those specific risks, and I'll show you the timeline of when these storms are going to roll through our area coming up.
The state is now offering updates on the number of cases and deaths several times throughout the day. It can be overwhelming to try to make sense of it all. Experts tell Joe Hankey the number of new cases alone won't tell you the complete picture of the impact here in Georgia.
The state is constantly changing the amount of data on COVID-19 it is collecting and then presenting online, and also continues to update how it presents the data. One example is the evolving timeline presenting newly confirmed COVID-19 cases by date.
There's a lot of factors at play.
Dr. Robert Bednarczyk is an assistant professor of global health and epidemiology with Emory University. He agrees the focus lately is on the most recent 14 days of cases, after the White House advised states to begin reopening after they see a sustained decline in cases over 14 days. Ben Archek, though, says a graph showing the latest number of cases alone does not show the complete picture. Other factors need to be considered alongside it.
How many people are being tested? How many positive tests are there? What does the hospitalization levels look like? So that we can try to put all of that together to get a really comprehensive picture of, are we just treading water? Is it getting worse? Or are we actually starting to turn the corner a little bit?
He says as testing, for example, is expanded, the number of cases would most likely increase, but with more information in hand, expanded contact tracing, and isolation of positive cases, the situation could still be considered to be improving, or changes in policy could lead to new increases as more businesses reopen.
If we see some of the numbers starting to decline a little bit over the next few weeks, that doesn't mean that they can't come back up again.
One place where Ben Archek and other experts say the state could improve the data it is collecting is on the race of patients. The state's numbers show the leading race for total cases is African American, but 31% of cases still have race listed as unknown or missing.
Would show us, be able to not only target our interventions better, but also go and see where the disease may be affecting populations differently.
We're tracking another outbreak at a senior center here in Metro Atlanta. The state says as of yesterday, 7 people have now died at Pruitt Health in Marietta. 81 residents at the facility have tested positive, along with 11 staff members. But we've noticed some discrepancies in the other numbers that the facility is reporting and what appears to be an information lag between it and the state. Our Reveal investigators are looking into it. As of last week, deaths at long-term care facilities accounted for about 10% of the COVID-19 deaths here in Georgia. The state has vowed to increase testing in Georgia, and it has. The governor said today 13,000 new tests were reported to DPH. That is the largest single-day increase since the outbreak started. But we are hearing from people who say there's still some confusion about the testing offered here in Georgia. Caitlin Ross is working to get you answers.
By now, you've seen the headlines about COVID-19 testing. One is a nasal swab, one's a blood test. So how are they different? We got this question into our newsroom. What is the difference in the tests determining if you have COVID-19 or antibodies? We took that straight to the CDC's Dr. Jay Butler, who says you only take the antibody test weeks after you think you've had the virus.
The second or third week after illness onset. So it's not useful as a diagnostic tool in the acute infection, but it is a way to determine if someone has been exposed.
The antibody test is a blood test. It will not tell you if you currently have a bad case of COVID-19, only if you were exposed at some point, even if you were unaware and didn't show any symptoms. If you currently have the virus, you take a nasal swab to get tested. Governor Brian Kemp told reporters yesterday he wants to see increased virus and antibody testing as the state continues to reopen. Though Dr. Butler says the antibody test may not prove you are immune to getting COVID-19 again.
We don't know if those antibodies are protective. So when we talk about whether or not it'd be possible to certify someone as immune, the science is not there yet.
Next on Primetime, a man who survived COVID-19 reaching out to help the people who got him through his sickness.
Staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
COVID-19 lands a man in the hospital for nearly 3 weeks. Now, we shared Richard Pellegrino's story of how he battled back with the help of healthcare workers, family, and friends. Now, the one motivation is being able to get back on his feet and say thank you. And now he's saying thank you in a huge way. Matt Pearl has his story tonight.
It is a time where we feed for inspiration off each other.
Inspired me so much, I just had to listen.
Malcolm Lewis runs a coffee shop in Austell. Last week, the shop got a call from a regular customer whose story had touched tens of thousands.
In one word, I went through hell, and I'm now in heaven.
Richard Pellegrino was diagnosed with COVID-19 and put on a ventilator. He was in the hospital for 19 days until, finally,
hi, Daddy. Hi.
He rolled into the sun and took his first steps to family. That's where our first story ended, and where a new one began.
For me, that's just kind of the full circle of a blessing. You know, you're blessed and you're able to now go back and reach back and bless somebody else.
Richard called Malcolm's coffee shop. He offered to pay for 60 lunches for the team at Wellstar Cobb that helped him through.
Saving one's life is priceless, so there's really nothing I can do to repay them except to honor their everyday work.
11 days after Richard stepped out of his chair, his gift of gratitude arrived in Austell.
You know, this is just a beginning. We don't have to wait for a crisis like this to help each other.
It's just a source of encouragement, inspiration, and hope. You know, I think right now everybody needs hope.
The Georgia Department of Labor says with some businesses reopening, it is already getting fewer calls. Still, a record number of people in Georgia have filed for unemployment. There are thousands of families struggling to feed their families. Bill Liz takes us inside Atlanta's top nonprofit, which is working to support those in need.
With money tight or none coming in at all, families are in great need of food. They're turning to more than 700 food pantries and volunteer food stands throughout Metro Atlanta. They're all getting their fresh supplies, their milk, and their staples from the Atlanta Community Food Bank. Food Bank CEO Kyle Wade says with demand up 30 to 40%, he's never seen anything quite like it and what COVID-19 has created.
Well, this crisis has been unlike anything we've ever experienced before. We've certainly been through Hurricane Katrina, 9/11, the Great Recession, but this just really exceeds all of them in scale and complexity.
The impact of the coronavirus has forced the food bank to add schools, YMCA branches, and even groups from hotels to its vast network. And that means a need for an ample supply of produce and milk. Publix, for one, just delivered 4,000 gallons of milk and a truckload of fresh produce. But what's now required and the costs involved are mind-boggling.
Because the food supply is tight right now, we're buying lots and lots of food. We're spending right now well north of $1 million a month. And in fact, 1 week we spent $1 million just buying food. We're now distributing about 2 million pounds of food every week out to the community. And we intend to sustain that effort, for the next several months.
The Atlanta Community Food Bank says that since mid-March, it has already received more than 16,000 website inquiries and 6,000 text messages for food pantry information and locations in Metro Atlanta.
If you'd like to support the work of the Atlanta Food Bank, they would appreciate your time or donations. We do have a link on 11alive.com.
I'm meteorologist Chris Holcomb from the 11 Alive Storm Tracker, still talking with about 300 folks on Facebook Live right now. That's why my phone is sitting here kind of right in front of my face. But we've had a great conversation about what's happening, about the storms that are coming tomorrow. And I'm going to walk everybody through the timeline now of these storms as they're rolling into our area during the day tomorrow. Right now, we just have a couple little sprinkles that we've been watching over North Georgia. Nothing really major with this. This is the system, though. Check it out, folks. We have that line of storms with severe thunderstorm watches, numerous severe thunderstorm warnings, even a tornado watch, a couple of tornado warnings, and then also watching some of those storms that are moving through Louisiana. Those will push to the south. These are also moving to the south, and that's the main frontal boundary that is moving into our area during the day tomorrow. And that severe risk, we showed you this a little while ago, but it's that moderate risk, level 4 of 5 risk, out in parts of Texas, Oklahoma, moving into Arkansas. And that risk area weakens a little bit, but it does come into our area as a level 2 risk. That means that in these areas here, North Georgia, Metro Atlanta, down into Central Georgia, back into Alabama as well, there is a chance for some scattered, stronger thunderstorms, and some of those could have some damaging winds, hail, maybe even a spin-up tornado, but that tornado risk is on the lower end. It's not zero, though, but it is on the lower end. We have a medium risk for strong winds, medium risk for some pockets of heavy rain, also a medium risk for some hail, but that tornado risk is on the lower end. Here's a look at temperatures around North Georgia. Very comfortable out there tonight if you've been out during the evening hours. It's 71 in Atlanta. We still have lower 70s in Marietta, Duluth, and Canton, and Dalton, and Eatonton. Everybody else has fallen into the 60s. So a bit of a wide range of temperatures out there. Clouds, though, are building in. So the temperatures aren't going to drop as much tonight. This morning, we started off with a temperature of 53. I had to check that low that I have written down over on the side here. And the days before that, we were in the 40s. But in the morning, we're going to be in the upper 50s. So not quite as cool in the morning. It will be kind of mild as a few of those clouds build in. Now, it's going to start off dry tomorrow, and then those showers and storms roll in the afternoon. We're going to go with the 5, high temperatures near 75. All right, here's the timeline. Folks on Facebook, you've been waiting for this timeline as well. I'm going to step back so y'all can see what we're watching here. Look at the timeline. You can see in the morning, no rain here in our area, but clouds are building. More of those clouds push in during the day. At lunchtime, this is noon, you can see that line of storms out in Alabama knocking on the door. I'm going to advance this hour by hour now. I'll step out. You can see 2 o'clock. Those storms in West Georgia, 3 o'clock, approaching the west side here in Atlanta, moving through our area between 3 and 4. And then by 5 o'clock, these are over to the east of us near Athens. This is the first initial line, but we also have to watch other storms developing back behind this, and that will hold together, we think, through the evening hours, keeping them storms between Athens and Eatonton at 10, but we'll be clearing out here by later in the evening. And then Thursday, the breeze comes in, and we start to clear out a little bit more. So here's the 7-day outlook. 75 for a high Wednesday. Scattered showers and storms around. Clearing Thursday, a little breezy and cooler at 66, and then a nice dry stretch through the weekend. And look how we warm. 85 Sunday, 84 Monday, and then some scattered showers redevelop here by Tuesday.
So we talk a lot about testing for COVID-19. We've come a long way since January, but state and federal leaders are calling for more tests. Now we're seeing more talk of antibody tests as faster alternatives to testing for the virus and the possibility of immunity. We've had our Verified team talking to experts to break down testing and how it works. Here's our Jason Puckett.
There are a lot of tests for the coronavirus. The FDA has a list of 50 approved and about 115 more that are being reviewed, and they use a lot of different methods to get a test sample. There are nose swabs, finger pricks, blood samples, and more. So what's the difference with these tests? We brought in Dr. Michael Borowitz, the Executive Deputy Director of Johns Hopkins and the Laboratory Director of Johns Hopkins Hospital.
There's really 2 fundamentally different kinds of tests that tell you different things.
The first is the molecular test, or what most people think of as a COVID test. Most commonly, they use a nasal swab deep in your sinuses to get a sample. The sample is then tested for the actual virus itself.
Molecular tests, the tests that actually look for the RNA of the virus, are analytically very accurate.
The benefits of this test? According to Dr. Borowitz, it's the only definitive way of knowing if someone currently has the virus and whether they're contagious. The negative, it's a little slower, typically taking about a day for results. The second type of test is the antibody test. It's a quick turnaround test, results in minutes. Instead of testing for the virus itself, these tests look for antibodies your body made fighting the virus and the potential for plasma development used in treating the symptoms of COVID-19. But it has its limitations too.
It doesn't tell you just because a patient has an antibody that he's necessarily immune to the disease. That's what everybody wants to know, but that hasn't been proven.
and it can't tell you whether you're actually over the virus.
You don't know for sure when you have somebody who has antibodies is whether or not they're still infectious. So if they've had the disease and they've developed antibodies, they may or may not still be infectious.
So basically, the molecular COVID tests tell you if you have the virus. The antibody tests tell you if you've had it. And Dr. Borowitz believes as antibody testing continues to develop, there's potential they can do more.
If we ever get to the point where the results of those tests are not only telling you exposure, but also telling you immune status, then they become extremely important, because then at that point, you can start using them for making decisions about how you manage people.
If you've got any other questions for us to look into, send us an email.
Cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11 Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people, or are you doing this to make money, or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID.
There's a local store out there helping to fight COVID-19 in a very unique way by giving away free shoes to all those on the front lines. 11 Alive's Jay Plyburn has their story.
We have a running store here in Forsyth County. So we're doing this in support to essential workers, and we are trying to support all of those people that are in the front lines. We feel the love, and they have been supported of us in the past. So I believe it's our turn to give something back to the community. So we're giving away these shoes that are gently used by this brand. It's called Hoka 11 that we partner with in this particular giveaway. They just come to the store. We're standing outside, curbside right now with a few tables of those shoes, and there's no stipulations other than, you just come on over. Maybe you want to show us your ID, that's fine, but you don't have to have an ID. It's an honest system, and hopefully there's a pair of shoes for you that fits you well.
A lot of these first responders have to be on their feet for many hours of the day. Are these shoes in particular good for that sort of stuff?
Oh yeah. That is probably one of the best-selling brands for that particular worker, the people that spend a lot of time on their feet. It could be the grocery stores, could be the nurses, doctors, paramedics, firefighters. So yeah, that's our number one selling shoe for that particular market. We have approximately 70 pairs combined between men and women. Once they're gone, they're gone.
So at the close of business tonight, only 2 pair of shoes remained. So to check out the slideshow we put together, just go to mycomingnews.com.
Our Reveal investigators visited grocery stores across the metro to see how well customers and employees are following guidelines meant to keep them safe. The results next on Primetime.
Become more clear. The things we take for granted, the people we depend on daily. Here at 11 Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help?
We have a quiet night out there right now. If you've been outside, you have been feeling really comfortable temperatures out there and nice conditions. There have been just a couple of sprinkles over parts of North Georgia as some clouds are starting to build in. But look what we're watching that's going to be moving into our area tomorrow. This is a big-time storm system, a squall line of storms from Illinois, Missouri, moving into Arkansas, Oklahoma, and now into Texas. And it's along this line where we have numerous severe thunderstorm watches, a tornado watch, numerous severe thunderstorm warnings, and even we've had some tornado warnings along that too. This system is moving our way, and out west tonight there is a pretty large risk area of moderate risk, level 4 or 5, and then also a level 3 risk that covers a lot of states too. And that's where we're seeing all of those severe storms that are rolling through. And it's moving to the east. It's going to be coming closer to us. Our risk areas tomorrow are going to be in that level 2 risk. We think these storms will be a little weaker by the time they make it into our area, but really most of North Georgia, all of Metro Atlanta, and areas down to the south are in this level 2 risk, meaning we could see some scattered storms with some damaging winds, hail, maybe even a spin-up tornado. The tornado risk, though, is on the low end. This is timed most likely for the afternoon and early evening hours. Stay with us. Coming up in just a few minutes, I'm going to walk you through that hour-by-hour timeline.
All right, Chris, we're going to see you in a couple of minutes. You know, folks, a lot of you are sounding off tonight on our 11 Alive poll when we're asking, do you think it's a good idea for Georgia to open up its malls by this Friday? More than 700 of you have already answered that poll, and 84% of you say no, you don't want to see the malls open up this Friday, and 16% are saying yes, more than 700 people. So tonight we're hearing from a retail expert who says that that industry is going to take a while for that industry to recover.
This pandemic has just accelerated what might have taken an additional 5 or 10 years and compressed it into a few months. I would expect that sales will still be slow even after they
Well,
open
the poll
their
is
doors.
still open, and you have a chance to weigh in. Just go to our website, 11alive.com/vote, or you can go to our 11 Alive news app as well, and let us know, do you think it's a good idea for the malls to open up this Friday?
Georgia's shelter-in-place order is set to expire after Thursday, and while Governor Kemp says the numbers support lifting some restrictions, he hasn't made the decision whether or not to extend it tonight. Researchers warn that even lifting restrictions gradually over the next month could mean a second wave of new infections in the summer. Elwin Lopez has that story.
We are expecting this spike to come in about 2 to 3 months after the restrictions are lifted.
Turgai Iyer, a health systems engineering professor at Georgia Tech, has collaborated with Harvard and others to develop a COVID-19 simulator, which predicts a second wave of COVID-19 cases in Georgia this summer based on easing restrictions.
It's very easy for this virus to accelerate and spread in the community, but it is very difficult, as the WHO director said, to decelerate the spread in the absence of pharmaceutical interventions.
The simulator estimates Georgia will see more than 23,000 deaths by August if restrictions were lifted in 4 more weeks. If restrictions are kept in place for 12 more weeks until September, the number of projected deaths drops to 1,940. Iyer says a second wave of cases could not only affect public health, but the economy as well.
If we go through a second wave and if the cases increase significantly as we project based on our model, there is a good chance that we may go back to what we are experiencing now. We may go back to these restrictions.
Iyer says part of his concern with easing restrictions too soon is that it could lead people to believe things are back to normal, lowering public awareness, which could lead, he says, to an uptick in cases.
Dozens of grocery store workers nationwide have died from COVID-19. Many of you have asked us how safe your grocery store is. Are workers required to wear masks, and who is enforcing the rules? Chief Investigator Brendan Keefe has video showing a wide range of policies and practices.
Grocery store workers come face to face with the virus every day. This is the only place where every American is allowed to go, with workers who must interact with hundreds of people every day.
Before this, grocery store workers were largely taken for granted. You're now universally seen as the heroes keeping the supply chain going.
The reason I'm doing this isn't because I want to be a hero. It's because I am trapped here, because we can't quit and get unemployment, and we're not going to get fired. We are forced to be there. We are forced to be exposed.
The CDC recommended everyone wear face coverings in grocery stores and pharmacies starting on April 3rd. It took another 17 days for Walmart, Publix, and Atlanta area Kroger stores to require their workers to wear masks. Before the policy changes on April 20th, it was a choice the workers had to make for themselves, even when handling food.
We recorded openly using our phones while shopping in multiple grocery stores over a 2-week period, but only while shopping for necessities we needed ourselves.
At this Kroger in Johns Creek, the week before the company required masks, the worker collecting the carts wasn't wearing one. There was no one sanitizing the carts when we arrived.
Is there nobody wiping them?
We found the same thing at this Kroger in Alpharetta. In both Kroger stores, there were spray bottles, but empty paper towel rolls next to the carts. This cashier at the Johns Creek Kroger was wearing a mask before Kroger required them, but look closer at his hands. Those gloves are ripped as he touches every single item. In the produce section the same day, a worker with no mask touches her head to adjust her glasses with an apple in her hand. before putting that apple out for sale.
Save that money.
We went back to the Johns Creek store the first day Kroger required masks and found an employee with her mask under her chin while talking with another maskless employee. Another one with a mask and one without in the deli food prep area. The cart guy had no mask on Monday. Then on Tuesday, the cart collector had a mask but touched his head before pushing the carts with the same hand. This Publix in Buckhead has one-way aisles and encourages social distancing among customers, but not all employees were following those same recommendations. But all carts were sanitized. Publix says it has updated its protocol as the CDC guidance has evolved. We spotted employees socializing at the Suwannee Walmart the first day the company required masks. We didn't see anyone enforcing the mask rule, but we did see several employees stocking shelves and handling food with their masks on their chins, under their chins, or completely missing.
Sorry, I don't want to get too close to you.
Even after Walmart instituted its mask policy, this worker without a mask was stocking the produce shelves. Walmart does have a shield between the cashier and the customer, but we spotted 4 checkout lanes open right next to each other out of 7 possible lanes, which, like the Buckhead Publix, puts workers right next to customers in the next lane with no barrier.
You guys are all out of hand sanitizer, right?
Target has not yet required its team members to wear masks at all. We spotted an unmasked worker stocking the produce shelves at this Suwannee Target, where most of the checkout personnel were also mask-free, which is still allowed. The carts were all sanitized, however. Target says it has expanded rigorous cleaning routines to keep guests and team members safe.
Every time you come into the store, you are endangering us. And of course, you need to come once a week, twice a week for actual groceries. But for the people that are coming in because you have a craving for a chocolate bar, consider you need that chocolate bar so bad that you're willing to put hundreds of people's lives at risk.
At grocery stores all over Metro Atlanta, we saw used gloves discarded in the parking lots. Gloves a worker will eventually have to pick up. Kroger responded, "We are working with store managers and associates to address the issues you identified, and we encourage customers with concerns to reach out to us." Walmart wrote, "We are taking steps to ensure our area stores and associates are clear on the changes so this doesn't happen again." The full statements from Walmart, Kroger, Target, and Publix are available right now on 11alive.com.
There's a local business trying to feed hundreds of frontline workers every single day all across Forsyth and Hall counties. 11 Alive's Brittany Kleinpeter has their story.
I don't know if you've seen our station here, but we're kind of manning the area here.
Yeah.
And the officers are just pulling up, so we're just getting them the food. We're a Forsyth business called North American Automotive Group. Along with our partners at Allstate, we had some extra marketing money that typically was pretty restrictive, and they permitted us to use that for whatever we wanted for first responders. And we're feeding all 4 shifts of the Forsyth County Sheriff's Department. That's 160 officers plus their tactical units. And we're also feeding Northside Hospital. We're feeding about 125 of their nurses, doctors, and EMTs. We've kept all our employees on staff and let them take advantage of doing some things that can help our community. I mean, what else are we going to do, right? Might as well smile and do the best we can.
Yeah, exactly.
You know, Brittany also tells us tomorrow the group is going to travel up north to feed the Gainesville Police Department and the Northeast Hospital in Brazelton. If you want to learn a lot more, just head to mycomingnews.com.
Next on Primetime, the first K9 coronavirus patient in the United States. A look at some of the stories you may have missed today.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11 Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people, or are you doing this to make money, or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
I'm Jennifer Bellamy from our 11 Alive studios with 3 quick headlines you may have missed today. The United States now has what's likely its first dog to test positive for COVID-19. He's a pup named Winston out of North Carolina. His owners say he's experiencing mild symptoms, gagging, and a lack of appetite. Now, Winston isn't alone in this. The couple who owns him, along with their son, also tested positive for the virus, but their daughter and their other dog and cat all had negative test results. This comes after 2 domesticated cats tested positive last week in New York. The CDC says there's no evidence that animals play a major role in spreading COVID-19, but you should treat them like a member of the family, meaning no interaction with people or animals outside the household during the pandemic and keeping them away from anyone who's sick. Well, a new poll finds more than 30% of Americans have witnessed some instance of COVID-19 related bias against Asians. This comes from a new Ipsos survey from the Center of Public Integrity. The poll found 60% of Asian Americans, who made up 6% of those surveyed, experienced that behavior. The Asian Pacific Policy and Planning Council reported 1,500 incidents of harassment against Asian Americans in a 1-month period since March. That includes a family stabbed at a Sam's Club in Texas. Researchers say the rise in anti-Asian bias may reflect an increased tendency to blame certain groups for the coronavirus pandemic. And are the Tokyo Olympics next year really realistic? The head of Japan's medical association isn't so sure. He said it would be a challenge to hold next year's Summer Olympic Games if a vaccine isn't developed. But it's not just a vaccination. He says medication to stop the spread is needed as well, and he hopes both are produced quickly. Medical experts have said it could take months, even years, before safe vaccinations are approved. The games, originally set for this summer, have already been postponed until July of 2021. The president of the Tokyo Olympic Organizing Committee told the newspaper there will be no more delays. If the games can't be held in 2021, they will be canceled.
Remember this impressive show of support in the sky over a hospital in Fayetteville? People could see it from miles away. It's a group of military veterans and pilots who are trying to send a strong message to those affected by COVID-19, the patients, the healthcare workers as well. Here's Latasha Gibbons.
We've had as many as 16 airplanes to go up there and make hearts.
The heart is a symbol of love, care, and compassion.
I've been flying for over 50 years, and I flew in the military.
But now, over a brilliant divine canvas, Don Roberts and his band of brothers, known as the Falcon RV Squadron, have a different mission.
So many people are really struggling in so many ways.
Their mission? Much needed hope and encouragement. The Flyers have been crafting hearts in the clouds above hospitals all over Georgia.
And you feel so compassionate for the caregivers and the responders and all the medical people that we can't do enough of them almost.
Some are 3 miles wide.
We fly 8 airplanes side by side, and when I call, basically give them the signal, well, they'll start their half of the heart, and I'll start my half of the heart, and then we'll converge down somewhere downstream, if you will.
And whether it's above the buildings in Buckhead, the treetops in Thomaston, or your front yard in Fayetteville, the response means a lot.
That's amazing. It's a heart.
The response has been so positive. It's very touching, you know, when you take part of this. It really is emotional for us too, to help, you know, bring a message of hope to people in various parts of the state.
The Hearts of Hope over Georgia are not only touching those who see them, they also have a special way of connecting the men who are creating them.
You fly in formation almost everywhere you go, and you feel a sense of strength when you fly with people that have the same mission, and you feel like it's like a brotherhood of flyers.
Still watching those storms out west right now. Nothing going on in our area, but it's still really active, even at this late night hour here, out through parts of Oklahoma, moving into Texas, moving into Arkansas, through Missouri, and into Illinois. Numerous severe thunderstorm warnings, and then we have a couple of new tornado warnings within that, those small red polygons that you see, and then severe thunderstorm watches in effect as well. So very active to our west tonight, and that's where most of the action is going to be during the evening hours and overnight. And we mentioned earlier, that's where we have that level 4 risk, moderate risk in Texas and Oklahoma, parts of Arkansas, and then that's surrounded by a level 3 risk. So more storms are going to be there tonight. They're not going to die down that much overnight tonight. By the time they get into our area, we do think that they'll be a little bit weaker, but still, we're in the level 2 risk, a slight risk, which is the yellow color over North Georgia and Metro Atlanta. This is where we have the potential for some scattered, stronger thunderstorms as that line is going to move through late tomorrow afternoon or during the afternoon hours into the early evening. Damaging wind, possible hail, maybe even a spin-up tornado. But that tornado risk is really on the lower end, and you'll see that here with the severe threats. Tornado risk is low. The wind risk is medium. The heavy rain risk is also medium, and the hail risk with this one is in the medium range too. There could be some large hail in association with these storms. I don't think it'll be widespread, but it would just be in some pockets out there. Take a look at the pollen count today. 130. So yesterday we were in the low 100s, like at 101. Today we're up a little bit at 130. Main pollens present are oak, hickory, pine, cottonwood, and walnut. Grasses are in the moderate range, the weeds are in the low range, and the mold has been high and extremely high this week, but it's now back to the moderate range. So a little bit of a break, if you can say that, with that mold out there. Our high today just shy of 80 degrees. We had up to 79 this afternoon. We should be around 76, so we are 3 degrees above the average today. And our low this morning, actually 3 degrees above average. This morning, we were a couple of degrees below average when we hit 53. We should be around 55 for this time of year. I know we've got more rain coming in here, but you know, we could afford some dry days as we have a surplus of 14 inches, a little bit more than 14 inches above where we should be in rainfall. Once we get past this storm risk tomorrow, we will enter in a drier pattern for the end of the week and into the weekend. Comfortable temperatures right now, we're 71 here in town, 70 still in Marietta, Canton, Dalton. We had 70s in Athens a little earlier. That has now gone away. Everybody else is in the 60s. And with cloud cover tonight, we're going to see these temperatures not quite as cool as they've been the past few mornings. In fact, in the morning we'll be in the upper 50s. And then by 9 o'clock, already up to 64, 70 by 11, 74 at 1. But then look what happens in the afternoon hours. You see these temperatures that'll be in the lower 70s into the 60s, and that's when we see those thunderstorms that are going to be moving through. So here's a look at the headlines. Storms on Wednesday. Some of those could be severe. Then a dry pattern settling in late week into the weekend, and then hotter temperatures this weekend too. Here's the wasometer for tomorrow, a 5. Low of 58, high of 75. That's our scale from 1 to 11, where an 11 is a perfect day. Here's the timeline. Dry tonight, dry in the morning, also dry at lunchtime. This is at lunch. You see those storms moving in through Alabama, coming into West Georgia between 1 and 2 in the afternoon, approaching metro Atlanta by 3. Between 3 and 4, these storms roll through Atlanta. They're over to the east by 5, but then we're watching some additional showers developing here on the backside of this that could keep some storms around the Athens and Eatonton area till around 10 o'clock before everything finally pushes out. And then on Thursday, clearing skies, 20% chance for a lingering shower, cooler, and then dry through the weekend, warming up 85 by Sunday, another chance for some showers rolling in by Tuesday.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11 Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people, or are you doing this to make money, or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks.
Keeping SEC football players in peak physical condition takes an army, even in the age of coronavirus.
A 60-yard shuttle. We touch right hand the whole time. We're going 5 back, 10 back, 15, and finish through the line.
And it's not just the strength and conditioning that's important, it's nutrition too.
Hey Dog Nation, welcome to Try It Tuesday.
That's where Call Your Perno comes in.
They're really starting to think outside the box and keep things interesting.
She's the director of football performance nutrition at Georgia and has had to stay creative to keep those Bulldogs eating right while staying home.
We know that they're on their phones. We know that they're doing social media. TikTok is new, it's fun, it kind of makes things more interesting. So we really wanted it to be something that catches their eye, something that was entertaining, but also had really good nutrition content in the background.
They don't want to see us on TV unless it's the news. I got something to prove. Yeah, I'm young, but got something to lose.
For some of our guys who need to gain weight, some of our guys who need to lose weight. So kind of making sure that we're providing them with meal plans and education on kind of how to do this themselves.
Through various social media platforms, she's continued to educate the players through cooking tutorials and posting their 5-star chef results.
Look what's going down, Miss C. You already know.
I didn't know, how well it would be received and stuff. And I had like a couple, especially my D linemen, they've been like, oh my gosh, Miss C, I love that.
All right, Miss C cooking it up. All right, guys, well, we will see you over on 11 Alive coming up at 11 for Up Late. Thanks for hanging with us tonight. Also, be sure to stay weather aware through tomorrow. Biggest trials and more. Subscribe to 11 Alive today.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11 Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
11 Alive News Primetime on the ATL starts now.
Tonight at 10 businesses across the country struggling to keep their doors open. A look at just how tough it is in one part of Metro Atlanta.
And even as the state sees record testing numbers, some Georgians say they have been anxiously awaiting results for more than a week after being exposed.
Plus, college students across the state are worrying about their final grades amid the stress of the pandemic, what they are asking for from the university system of Georgia. But first tonight on this Tuesday at 10, a big step in sparking Georgia's economy back to life.
Yeah, Jeff, so the Simon Property Group announced that it will open all 7 of its Georgia malls on Friday after Governor Kemp's stay-in-place order is set to expire. All employees will have to wear masks and be encouraged to take frequent breaks to wash their hands. As for shoppers, CDC-approved mask and hand sanitizing packets will be made available. This will not be a typical shopping experience. Simon will have free temperature testing available as well and is encouraging retailers and other tenants to use technology for contactless transactions. 11 Alive's Natisha Land spoke with one employee at Lenox Square who says reopening Friday is too early.
Well, Aisha, we learned about these reopenings from an internal email, and the pandemic sent an already struggling retail industry into a complete nosedive. There's some retailers that are behind on rent, others that are on the verge of closing for good, but experts say there is hope, but recovery will be slow. This is how Lenox Square looked right after news of the shutdown. That was nearly 2 months ago. Now its doors are set to reopen.
Honestly, I think it's too soon.
Furloughed luxury retail employee Shar has doubts.
We haven't really flattened the curve yet. It's a risk.
An internal memo revealed Simon Property Group will reopen 49 malls across the country, including 7 in Georgia, Lenox Square and Phipps Plaza in Buckhead among them. The opening is needed to boost the economy and help save already struggling department stores.
This pandemic has just accelerated what might have taken an additional 5 or 10 years and compressed it into a few months.
High-end retailer Neiman Marcus is expected to file bankruptcy any day now, making it the first department store casualty of COVID-19. Still, Shar is optimistic stores will survive.
People still want that experience. They still want that one-on-one contact.
But it will look different, similar to the opening of malls in Dubai this week and Wuhan about a month ago. Masks and gloves will become part of the employee uniform. Customers will be encouraged to wear them too.
Retail will just have to evolve along with the needs of the customers and whatever it is that the customers are comfortable with.
Now, experts say they expect those sales to come back very slowly, but they did say one thing that brings a little bit of optimism here, that customers will be coming back as it applies to their comfort level. So that could be based on, it could be a lot of people by Friday, or it could be months down the road. Guys?
All right, thank you. Governor Kemp is sticking by a statement that overall state numbers support his decision to give some businesses the option to reopen. The governor says recently he had a good call with the president. Last week, the president was critical of the timing of Georgia reopening.
We're moving forward with data and information and decisions from the local public health officials, meeting and working within the guidelines of the great plan that the president has laid out, and you're seeing many other governors do that as well.
Yet the state numbers still show about 23% for an increase in cases and a 26% increase in deaths since last week. New at 10, we have been bringing you the very personal stories of people who have poured themselves and their life savings into their own businesses, and now they are simply struggling to survive. Tonight, a sobering snapshot by the numbers of how tough it is in one part of Metro Atlanta. Here's John Sherrick breaking it down.
It is a bleak view of present and future if nothing is done to help.
The city of Sandy Springs and 5 other cities surveyed business owners across North Fulton County, more than 800. 60% of the businesses are open, 40% are closed. 37% have laid off some or all of their employees. 65% of the business owners say they may have to reduce staff permanently in the next 3 months, if they're still in business. 60% of the business owners in North Fulton County say they may have to close permanently, not sure they'll be able to survive. During Sandy Springs Online City Council meeting last week, the city's Director of Economic Development, Andrea Worthy, said the city is using the survey to figure out what help to offer on its website and in person, because getting help now can be challenging.
I heard someone on the SBA call say that it's like putting an airplane together as you're moving down the runway to take off. But don't give up, and we can help you out.
Adding to the business's worries, 70% think there's a chance their customers will never come back.
Right now, we're monitoring the chance for severe weather in the metro area tomorrow. Chief Meteorologist Chris Holcomb has a look at the latest models. Hey, Chris.
Hey, we're watching these storms that are out to the west right now that are looking pretty potent, where we have numerous severe thunderstorm watches and even a tornado watch, and then numerous severe thunderstorm warnings, even a couple of tornado warnings with this. This is a really impressive squall line that has really strong storms with it. It is going to be moving into our direction, but it's going to stay out to the west tonight. So there are no concerns tonight while you're sleeping about severe storms. That's going to be mainly well to the west, where there is a level 4 risk, level 4 out of 5 risk in parts of Texas into Oklahoma, and then surrounding that is a level 3 risk, then a level 2 risk. As this system moves our way, we don't think it's going to be as strong, but still strong enough to put us in this yellow shaded region, which is the level 2 risk, 2 of 5. Meaning there's a good chance tomorrow for some scattered strong thunderstorms, and some of the risks would be damaging wind, hail possible, and even a spin-up tornado is possible. I don't think it's going to be widespread tornadoes, but maybe a brief spin-up tornado, and that tornado risk is really going to be on the lower end. Stay with us. We'll break down these specific risks, and we'll have an updated timeline of when these storms are going to be moving through the metro area.
Governor Brian Kemp says the data supports his plan to start reopening the state's economy, yet we continue to see cases rise in the state as more tests are processed. The state health department now reports nearly 25,000 confirmed coronavirus cases in Georgia. That's a 23% jump from a week ago. Keep in mind, this comes as the state processed 13,000 tests just today. There are now more than 1,000 deaths in Georgia and nearly 27% spike since last Tuesday. But a Gordon County family says they've been waiting 10 days for their father's COVID-19 test results. This comes after Governor Brian Kemp announced yesterday that a partnership with Augusta University and Georgia State University is increasing testing and returning test results within 72 hours. But one viewer who wanted to remain anonymous says her father is at Calhoun Healthcare Center in Gordon County, where 21 residents and 7 staff members have tested positive and 4 residents have died. But she still doesn't know if her father has the virus.
It was the 18th, the National Guard came in and they tested all patients there. And as of this moment, we still have no test results. By the time they get those test results back, they've already infected hundreds of people without knowing it.
The state announced a plan to increase free public testing starting today, but the viewer says she just wants the results of the test her dad already took. We want to include your voice in the conversation about coronavirus testing. Call us and leave a message at 678-765-9514. Tell us about your experience getting tested. Make sure to tell us your name, where you're from, and the best way for us to contact you. We may include parts of your message on air.
Students across Georgia say they are at risk of losing their scholarships unless drastic action is taken. They're calling on the University System of Georgia to institute a pass-fail system in their classes instead of the traditional letter grades. And new tonight, Ryan Kruger tells us many students worry they will never be able to return to class again.
With classrooms across the state empty, dozens of college students went online in a Zoom conference call to ask for help during this, at times, rocky transition to remote learning.
As a student with learning disabilities, I personally feel like I've been disproportionately affected.
The students from every public college in the state are asking for the University System of Georgia to allow pass-fail options for their classes.
I would be able to at least keep up at this pace I'm at right now.
Here's how pass-fail works. Instead of the traditional letter grades of A to F, students will either be given a pass or a fail. They argue the letter grades during these unprecedented times could negatively impact their GPA. In a statement this afternoon, a spokesperson said, "We are confident our students will rise to the challenge and the USG will do everything in its power to help them to do so. We trust our faculty to teach and grade students effectively."
How insulting. The fact is that if the Board of Regents cared about students half as much as they do their own businesses, we wouldn't be in this position.
So, Ryan, the pass-fail system has been implemented at some other schools across the country. Even in the Ivy Leagues, we have seen that as well.
Yeah, that's right, Jeff. We're talking about Harvard, Yale, Princeton, just to name a few, some of those prestigious universities in the country. They've also instituted pass-fail because their students said they were worried that traditional letter grades would be impacting their GPA during this rocky transition we're all going through with remote learning.
All right. When you talk about the Ivy League and you're talking Yale and Princeton and Harvard, being in front of those books just makes you even more credible. Thank you, Ryan.
Ryan the Scholar. New COVID-19 hotspots are emerging in Georgia next. How one small county is dealing with the surge of new patients.
And a scam that is taking advantage of people out of work across the country, the fake online ad, you need to be wary of.
11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Health officials in Hall County say they are trying to stop an uptick in COVID-19 cases. The county is emerging as North Georgia's COVID hotspot, though it's still well below levels seen in southwest Georgia counties surrounding Albany. 11 Alive's Doug Richards takes a look at what's happening there.
At Northeast Georgia Medical Center in Gainesville, workers created a temporary unit to expand the hospital's COVID-19 capacity. Health officials say at least some of those patients are coming from the area's chicken processing plants. The plants are an economic engine for the region and normally a source of pride. Now they're also part of a pandemic.
Workers didn't have masks. I think the whole community didn't have masks.
Vanessa Ceruza is with the Gainesville-based Hispanic Alliance of Georgia, a community that powers much of the workforce in chicken plants.
This crisis has really come at us in a rather quick way. And if you're used to doing certain things in a poultry plant, it was just hard to adjust kind of the workplaces to what needed to be adjusted.
State data released at midday shows that Hall County has the highest rate of COVID-19 cases in North Georgia, including the rest of Metro Atlanta, with 544 COVID cases per 100,000 population. That's twice the rate of Fulton County. 16 other counties have higher COVID rates. All of them are in southwest Georgia. The man on the left is John King, Georgia's insurance commissioner and a native of Mexico. He visited Gainesville's Fieldale poultry plant Monday. He says poultry plant workers
really have a hunger for actually having accurate, verifiable information that is in their language that they could understand. They don't know who to trust.
We had 300 of people show up for a free test. Well, more than half were actually positive with no symptoms.
The good news in Hall County is the COVID-19 death rate is low relative to other hotspots, with healthcare workers geared up to treat it.
I'm meteorologist Chris Holcomb from the 11 Alive Storm Trackers, and we are watching very closely the storm system out to the west that is really firing up tonight with a line of severe storms moving through parts of Missouri, Oklahoma, moving into Texas, through parts of Arkansas, Illinois as well. You can see the new severe thunderstorm watches that have been in effect for the past hour or so, stretching down through Texas and Arkansas, and then additional watches here along the line. And we have numerous severe thunderstorm warnings, even some tornado warnings with that. We're watching this system because it is a very elevated risk for severe storms tonight out to our west. That's a level 4 risk out of 5, and then surrounding that is the level 3 risk. As this system moves our way during the day tomorrow, we don't think it's going to be as strong once it gets here, but we will still have some strong storms with it, and it's a slight risk. We're a level 2 of 5 risk, which isn't that low of a risk over all of North Georgia, metro Atlanta, and down into central Georgia. Here are the main threats: damaging winds, hail, maybe even a brief spin-up tornado. But if you break down those risks, here's a look at the ones that we're watching that can be a little more likely. That would be a medium risk for some damaging winds possible, medium risk for pockets of heavy rain. The tornado risk is on the low end based on the ingredients that we're seeing in our atmosphere tomorrow. It's not a zero risk, but it is low. So we don't think we would see a lot of tornadoes around. And then the hail risk is also medium. Just be aware that we can have some storms that have some hail with that during the day tomorrow. If you've been outside tonight, it is very comfortable, and it's not as cool tonight as it's been the past few nights. Right now, we've just moved below the 70-degree mark. We're at 67 here in town. We did have some 70s on the map earlier. Right now, Dalton is the only place at 70. Everybody else is in the 60s. We do have a cooler 59-degree reading up in the mountains up in Clayton. Watch these temperatures tonight, how they're going to be pretty much holding in the 60s. I think we'll dip down into the upper 50s here in between 6 and 7 in the morning. And the first part of the day tomorrow is going to be dry. It's the second half of the day during the afternoon and evening when we see those storms moving through. So we're going to go with the 5 on the wazometer, low of 58, high of 75. Those storms entering later in the afternoon. Here's the timeline. You'll see here in the morning, this is at 7, we're dry. Clouds are building in from the west. By noontime, those storms are over in Alabama and they're approaching West Georgia. Once we get to 2 o'clock, you can see those storms crossing over the line. I'm going to hit this hour by hour here. 3 o'clock, closing in on Atlanta on the west side with those bands of heavy rain, damaging winds possible. 4 o'clock through Atlanta, pushing over to the east. By 5 o'clock, storms from Athens to Eatonton, but then additional storms develop here, and those will swing through, still maybe hanging out in Athens and Eatonton even late tomorrow night before things clear out later. And then by Thursday, we'll have breezy conditions and cooler air around with highs near 66. Friday morning, a cool start with highs near 73. We'll go with an 11 there. And then 80s for Saturday, Sunday, and Monday, even mid-80s Sunday and Monday before our next shower chance comes in here by Tuesday. Here's a look at your weather wow moment of the day. This is from Mary Beth Etheridge in the Stockbridge area. Interesting clouds that she saw. A lot of people in the comments said that that looked kind of like a starfish. I think I see it there. We would love to see your weather wow moment. And a lot of times we get these from our 11 Alive Community Storm Trackers page. You can become a member there on Facebook. Just search 11 Alive Storm Trackers. Ask to become a member. We'll let you in. You can be a part of this exclusive weather local community.
The Verify team is here to fact check the suspicious things you see online.
Well, I was very suspicious about not only the check, but also all the directions.
Mary Arponte from Arlington, Virginia, has been a teacher for more than 30 years. But because of the pandemic, she says she's been furloughed. So Mary answered an online ad saying she could get paid for wrapping her car. But when she got this letter and check, she got suspicious and contacted us.
And the check was over $3,000, and I give $3,100 to the installer, the wrapper, and then I would keep the remaining monies.
First, we looked to the Federal Trade Commission. On their website, they explain how typical car wrap scams work. You're told to deposit a check and keep some for yourself. You're then told to send the rest to a specialist who will do the work on your car. But the specialist never shows up, and the fake check then bounces as they make off with your money.
They wanted her to cash this check to go buy her supplies. And that's a big red flag when it comes to employment schemes, because you should never have to, cash your check to then go buy a computer.
Our researcher, Eliana Block, called the number listed on the letter. She got hung up on twice. We also contacted the company name listed on that check. The CEO told us that they did not issue the check and they are no way affiliated with any car wrap company. So we can verify this check is not legit, and our researchers told Mary not to deposit it.
If you have something you want us to verify, send it to us on Facebook, Twitter, or email verify@11alive.com.
A man who survived COVID-19 reaching out to help the people who got him through his sickness. That's straight ahead.
11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11 Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people?
Coronavirus landed a man in the hospital for nearly 3 weeks. We shared Richard Pellegrino's story of how he battled back thanks to the support of his medical team, family, and friends. One of his motivations to get well was to be able to say thank you. Now, less than 2 weeks after getting out of the hospital, he's reaching out to his nurses and doctors with an incredible act of kindness. Matt Pearl has the story.
It is a time where we feed for inspiration off each other.
Inspired me so much, I just had to listen.
Malcolm Lewis runs a coffee shop in Austell. Last week, the shop got a call from a regular customer whose story had touched tens of thousands.
In one word, I went through hell, and I'm now in heaven.
Richard Pellegrino was diagnosed with COVID-19 and put on a ventilator. He was in the hospital for 19 days until, finally,
hi, Daddy. Hi.
He rolled into the sun and took his first steps to family. That's where our first story ended, and where a new one began.
For me, that's just kind of the full circle of a blessing. You know, you're blessed and you're able to now go back and reach back and bless somebody else.
Richard called Malcolm's coffee shop. He offered to pay for 60 lunches for the team at Wellstar Cobb that helped him through.
Saving one's life is priceless, so there's really nothing I can do to repay them except to honor their everyday work.
Thank you guys so much.
11 days after Richard stepped out of his chair, his gift of gratitude arrived in Austell.
You know, this is just a beginning. We don't have to wait for a crisis like this. to help each other.
It's just a source of encouragement, inspiration, and hope. You know, I think right now everybody needs hope.
I love
that's
that, Jeff.
lovely.
He wasted no time giving back. He said that's exactly what he wanted to do, and he did it.
Well, what a lovely story that is. Isn't it
Yes,
beautiful? Yeah.
awesome. Great way for me to say good night to you. Happy Tuesday to you, and I'm going to see you guys on Up Late coming up in about 35 minutes on 11 Alive.
What day did you say it was? You know, I'm getting them confused.
I've been
again.
keeping track only by doing the news. It's Tuesday.
It's Tuesday.
It
Okay,
ends with
great.
a Y.
Thanks, Aisha. We'll see you on 11 Alive in about 35 minutes. We appreciate it. Coming up next on the Big 36, here is what is coming your way. Technical glitches are preventing thousands of small business owners from getting the financial help they need. We'll talk about that coming up.
Difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during prime time. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during prime time. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit CDC.
Georgia's shelter-in-place order is set to expire after Thursday, and while Governor Kemp says the numbers support lifting some restrictions, he has not made the decision whether or not to extend it. Tonight, researchers warn that even lifting restrictions gradually over the next month could mean a second wave of new infections this summer. Here's Elvin Lopez to report.
We are expecting this spike to come in in about 2 to 3 months after the restrictions are lifted.
Turgai Iyer, a health systems engineering professor at Georgia Tech, has collaborated with Harvard and others to develop a COVID-19 simulator, which predicts a second wave of COVID-19 cases in Georgia this summer based on easing restrictions.
It's very easy for this virus to accelerate and spread in the community, but it is very difficult, as the WHO director said, to decelerate the spread in the absence of pharmaceutical interventions.
The simulator estimates Georgia will see more than 23,000 deaths by August if restrictions were lifted in 4 more weeks. If restrictions are kept in place for 12 more weeks until September, the number of projected deaths drops to 1,940. Iyer says a second wave of cases could not only affect public health, but the economy as well.
If we go through a second wave and if the cases increase significantly as we project based on our model, there is a good chance that we may go back to what we are experiencing now. We may go back to these restrictions.
Iyer says part of his concern with easing restrictions too soon is that it could lead people to believe things are back to normal, lowering public awareness, which could lead, he says, to an uptick in cases.
For the second day in a row, technical issues delaying thousands of small businesses from receiving coronavirus relief loans. Banking industry groups say the SBA's loan processing system is still unable to handle the increased volume of loan applications. The applications are being filed by thousands of business owners trying to get aid under the Paycheck Protection Program, which is part of the government's $2 trillion coronavirus program. According to the SBA, the slowdown is due to its attempts to limit the number of loans one bank can submit at a time. Coronavirus relief loans are designated for small businesses, which is why some people were confused to find out that Los Angeles Lakers not only qualified, but they received over $4 million in aid. Maybe they can re-sign James Worthy with that money. The NBA team employs fewer than 500 people, which means the requirements of the U.S. Small Business Administration to receive aid from the coronavirus relief package. However, once they found out the funds from the program had been depleted, team owners decided to direct the loan to those most in need. 11 Alive financial contributor Andrew Polis says it is a loophole that certainly needs to be fixed.
Business that had under 500 employees, so I think that's where a lot were able to get through. If it was up to me, and the brief that I sent to Congress last week, publicly traded companies have access to resources that small businesses don't. They should have been prohibited to begin with.
There was a lot of backlash. 13 companies, including Shake Shack and Ruth's Chris Steakhouse, have returned a total of $98 million to the government. Add Delta to the list of companies updating their policies on protective equipment. The airline says it's making changes to its guidelines starting today to help stop the spread. Nick Sturdivant sat down and breaks down what this means for all of us going forward.
I'm at Hartsfield-Jackson International Airport, where starting today, Delta Airlines told me this morning that employees will have to wear this, yes, face masks in cases where they can't stay at least 6 feet away from others. This is the memo Delta sent me this morning. In it, the airline says the requirement is temporarily in place until at least June 30th. It also says it will make masks and face coverings available to employees, and they are free to use their own face coverings too. Delta says this new requirement applies to all public work areas, including break rooms and lounges, with exceptions for certain situations depending on the worker's role. The airline also strongly encouraging customers to wear masks and says it will make them available at ticket counters, gates, and onboarding airplanes. This comes as JetBlue announces a stricter policy. Starting May 4th, if you fly with them, you will have to wear a face covering. Its employees, just like Delta and American Airlines, will also be required to wear one. And just to reiterate, according to Delta, this requirement to wear face coverings will temporarily be in place through June 30th.
We're tracking another outbreak at a senior center here in Metro Atlanta. The state says as of yesterday, 7 people now have died at Pruitt Health in Marietta. 81 residents at the facility have tested positive, along with 11 staff members, but we have noticed some discrepancies in other numbers that are being reported for this facility and what appears to be an information lag between it and the state. Our Reveal investigators are looking into it. As of last week, Death at long-term care facilities accounted for about 10% of the COVID-19 deaths here in Georgia. The state has vowed to increase testing here, and it has. The governor certainly concerned. He said today only 13,000 new tests were reported to the DPH. That is the largest single-day increase since the outbreak began. But there is still some confusion about the testing offered here in Georgia. Caitlin Ross working to get you some answers.
By now, you've seen the headlines about COVID-19 testing. One is a nasal swab, one's a blood test. So how are they different? We got this question into our newsroom. What is the difference in the tests determining if you have COVID-19 or antibodies? We took that straight to the CDC's Dr. Jay Butler, who says you only take the antibody test weeks after you think you've had the virus.
The second or third week after illness onset. So it's not useful as a diagnostic tool in the acute infection, but it is a way to determine if someone has been exposed.
The antibody test is a blood test. It will not tell you if you currently have a bad case of COVID-19, only if you were exposed at some point, even if you were unaware and didn't show any symptoms. If you currently have the virus, you take a nasal swab to get tested. Governor Brian Kemp told reporters yesterday he wants to see increased virus and antibody testing as the state continues to reopen. Though Dr. Butler says the antibody test may not prove you are immune to getting COVID-19 again.
We don't know if those antibodies are protective. So when we talk about whether or not it'd be possible to certify someone as immune, the science is not there yet.
There are all kinds of strange, even potential dangerous suggestions out there about at-home remedies, claims they can protect you from COVID-19. Any truth to any of this? Here's our National Verify team.
The Verify team is here to shut down misinformation on social media, and we've been busy. Our inbox has been filling up with questions about some of these do-it-yourself remedies that are spreading online. So let's take a look at two of these viral claims to find out if they're true. Question 1. Let's verify, will drinking hot lemon water with baking soda kill the virus? To find out, we contacted one of our sources, a microbiology expert at the George Washington University School of Medicine and Health Sciences. He tells us that coronavirus attacks your respiratory system as a whole, including the cells in your throat. And lemon water just doesn't have the power to reverse that.
A free-floating virus at that point in throat is very, very little. The most of the virus is inside the cells. The drink cannot penetrate in the cells and kill the virus.
We also looked to the CDC and the WHO, neither of which had any evidence that this would work. So we can verify, this one is false. Okay, what about this online claim? Does blow drying your nostrils kill the virus? And this might sound a little out there, but online people are swearing that this works. Our expert says no. He says that would not be an effective way to kill the virus, and neither the CDC nor the WHO have pegged this as a possible treatment. The CDC says the best way to protect yourself is to stick to the basics. Wash your hands with soap and water, use hand sanitizer, avoid touching your face, and practice social distancing.
Blow drying your nostrils. That's a good one. That makes my hair grow, is what that. Coming up, the president called the U.S. Postal Service a joke, the stipulation he is proposing if the organization wants any relief money.
And we're watching these storms out to the west that are still very strong, prompting numerous watches and warnings there. That system's moving toward us. I'm going to have an updated timeline of what happens when it gets here.
Coming up, the Bulldogs have to stay ready for the season. But how is TikTok involved in that process? We will explain coming up next in sports.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11 Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people or are you doing this to make money or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11 Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference.
The coronavirus pandemic is taking a toll on the United States Postal Service, expected to cut mail deliveries in half, but the president pushing back on federal aid for the agency. He says he does not want to put money toward the USPS unless it raises its rates.
The Postal Service is a joke because they're handing out packages for Amazon and other internet companies, and every time they bring a package, they lose money on it.
This is a complicated issue that needs some context about how the Postal Service works and why it is asking for federal money. Here is Stephanie Simmons.
The United States Postal Service is currently all over the news. Some believe it's an outdated and underused government agency that should be broken up and privatized. Others say it's an important public service that guarantees inexpensive daily mail and parcel delivery. As the political debate over its future rages, here is what you should know about the U.S. Postal Service. The USPS employs over 600,000 Americans in all 50 states and territories. It operates over 31,000 post offices everywhere from New York City, population 8.3 million, all the way to Adak, Alaska, population 386. It has a fleet of 228,000 vehicles, which drive 230,000 daily routes, where mail carriers deliver an average of 142 billion letters and parcels per year. Finally, even though the Postal Service is a government agency, it uses zero tax dollars. They operate solely on revenue from their postage, products, and services. In the midst of the pandemic, the USPS has requested $75 billion in cash, grants, and loans in order to keep running. The USPS hopes the injection of cash will ensure its survival through the pandemic and beyond.
I'm Jennifer Bellamy from our 11 Alive studios with Three quick headlines you may have missed today. The United States now has what's likely its first dog to test positive for COVID-19. He's a pup named Winston out of North Carolina. His owners say he's experiencing mild symptoms, gagging, and a lack of appetite. Now, Winston isn't alone in this. The couple who owns him, along with their son, also tested positive for the virus, but their daughter and their other dog and cat all had negative test results. This comes after two domesticated cats tested positive last week in New York. The CDC says there's no evidence that animals play a major role in spreading COVID-19, but you should treat them like a member of the family, meaning no interaction with people or animals outside the household during the pandemic and keeping them away from anyone who's sick. Well, a new poll finds more than 30% of Americans have witnessed some instance of COVID-19 related bias against Asians. This comes from a new Ipsos survey from the Center of Public Integrity. The poll found 60% of Asian Americans, who made up 6% of those surveyed, experienced that behavior. The Asian Pacific Policy and Planning Council reported 1,500 incidents of harassment against Asian Americans in a one-month period since March. That includes a family stabbed at a Sam's Club in Texas. Researchers say the rise in anti-Asian bias may reflect an increased tendency to blame certain groups for the coronavirus pandemic. And are the Tokyo Olympics next year really realistic? The head of Japan's medical association isn't so sure. He said it would be a challenge to hold next year's Summer Olympic Games if a vaccine isn't developed. But it's not just a vaccination. He says medication to stop the spread is needed as well, and he hopes both are produced quickly. Medical experts have said it could take months, even years, before safe vaccinations are approved. The games, originally set for this summer, have already been postponed until July of 2021. The president of the Tokyo Olympic Organizing Committee told the newspaper there will be no more delays. If the games can't be held in 2021, they will be canceled.
You should be able to sleep well tonight, and no worries about storms coming into our area while you are sleeping during the overnight hours. It's going to be later tomorrow in the afternoon when the storms move in. This is where they are right now. It's probably not going to be a lot of sleep out in the Midwest here tonight as those storms are rolling through parts of Arkansas, Missouri, Illinois, coming out of Oklahoma, moving into the northern parts of Texas. Look at all of the yellow polygons you see here. Those are individual severe thunderstorm warnings, and then the red ones that you see here are individual tornado warnings coming out of the southern parts of Oklahoma. Very active night out to our west tonight. And this is the area where we see that level 4 risk. It's a moderate risk in Texas, Oklahoma, surrounded by the level 3 risk and the level 2 and the level 1 that comes up to the Alabama line tonight. So all the storms tonight are going to be out to the west. It's tomorrow when that system moves here. It's going to be a little weaker when it gets in here. I don't think we'll see the same types of weather in our area tomorrow as they're seeing out west, but we are in the level 2 risk, and there is the potential for some damaging winds, hail, maybe even a spin-up tornado, but the tornado risk is really on the lower end, but it's also not zero. It is possible that we could see a tornado out of this. Now, the pollen count today is 130. Back to still in the triple digits. Yesterday it was around 101. Main pollens present are oak, hickory, pine, cottonwood, and walnut. Grasses are moderate, weeds are really low, and the mold was extremely high. That's now into the moderate range as well. And our high temperature today, really close to 80. We got up to 79 degrees. That's above average. We should be at 76 for this time of year. Our low this morning was 53. It's not going to be as cool here in the morning as it was this morning. We'll be about 58, 59 degrees to start the day, and then warming up again into the mid-70s here for tomorrow. We could use a break from the rain, but we're going to see some showers that'll move our way tomorrow, so that's going to impact your get outside forecast. Now, if the kids are itching to get outside, or if you're itching to get outside from homeschooling or from working at home and some Zoom calls tomorrow, for a mid-morning recess in the morning, it's going to be okay. There will be more clouds that are building in for the morning hours. Now, I even think you'll be okay and dry for a backyard lunch tomorrow. Showers will be approaching coming in from the west. Our better rain chance, though, is going to be in the afternoon. Probably not a good idea to take the Zoom call outside tomorrow because the showers will be moving in, and storm risk as well with temperatures around 75. So here's a look at the headlines. Storms Wednesday, a dry pattern for the late week and into the weekend. And look at this, we get hotter as we go into the weekend too, with those temperatures into the 80s, even mid 80s for Sunday and into Monday. 5 on the wazometer, storms rolling in, highs near 75 degrees. 7-day outlook shows that as those storms exit late tomorrow night, it is going to be a little breezy, cooler on Thursday, and only a 20% chance for a lingering shower on the backside of that system, highs near 66. A great day Friday, mostly sunny, 73 for a high, 81 Saturday, mid-80s on Sunday and Monday, and then by Tuesday, our next chance for some showers and a few thunderstorms will move in.
Major League Baseball discussing a plan that would have the season starting in late June. According to USA Today, the league would be completely realigned in an effort to severely reduce travel. The plan is pending approval of medical experts and would need COVID-19 testing to be available to the public, so there wouldn't be a need for players to be in isolation. Well, trying to stay in shape during the quarantine, not easy to do. And Maria Martin has the story about how nutrition and football during this time is so very important, and they are working on TikTok to make sure that everything is going right and they are eating well.
Keeping SEC football players in peak physical condition takes an army, even in the age of coronavirus.
A 60-yard shuttle. We touch right hand the whole time. We're going 5 back, 10 back, 15, and finish through the line.
And it's not just the strength and conditioning that's important, it's nutrition too.
Hey Dog Nation, welcome to Try It Tuesday.
That's where Collier Perno comes in.
They're really starting to think outside the box and keep things interesting.
She's the director of football performance nutrition at Georgia and has had to stay creative to keep those Bulldogs eating right while staying home.
We know that they're on their phones. We know they're doing social media. TikTok is new. It's fun. It kind of makes things more interesting. So we really wanted it to be something that catches their eye, something that was entertaining, but also had really good nutrition content in the background.
They don't want to see us on TV unless it's the news. I got something to prove. Yeah, I'm young, but got something to lose. In the street,
For some of our guys who need to gain weight, for some of our guys who need to lose weight. So kind of making sure that we're providing them with meal plans and education on kind of how to do this themselves.
Through various social media platforms, she's continued to educate the players through cooking tutorials and posting their 5-star chef results.
Look what's going down, Miss C. You already know.
I didn't know, how well it would be received and stuff. And I had like a couple, especially my D linemen, they've been like, oh my gosh, Miss C, I love that.
As we continue to honor the class of 2020 today, we focus on Roswell High School and how they are still staying connected through this time of being apart.
Ben Suter, athletic director at Roswell High School. Seniors drive your team. The school is the community. We live in the city of Roswell. We are Roswell High School. These kids have grown up with Roswell jerseys and Roswell shirts. And once the realization set in that they'd already played their last games and get to kind of savor those last moments on the field, it's tough. While the seasons may not be going on, you can still celebrate them. Girls lacrosse, they still have they do their workouts via Zoom. Coach gets on there and has all the different pictures pulled up, and they're working out. Our football coach has started, even though it's a fall sport. He sends out the workouts and he encourages all of our athletes to do it. One of our baseball players saw him in the backyard picking up a stump that was in his backyard, and they cut down, and he's throwing it up in the air like a medicine ball. And it's everybody's coming up with their creative ways just to stay in contact with these kids. I wish I could sit here and talk about every little team in detail and go over every senior and every contribution right down to the manager. Extremely proud of it. They represent the Roswell name with pride.
All right, that is it for sports. We'll take a break. We're back right after this.
Going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people, or are you doing this to make money, or both?
Both. Take this email sent to the Verify team. Is it safe to have your house cleaned by outside workers? The best practice is to limit guests to emergencies only.
We know things are changing every day, but we're here with you. Continuous COVID-19 coverage during primetime. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11 Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system.
We start off the day dry in the morning, and then showers and storms move in the afternoon and early evening, and that's when they could turn severe. It will be clearing out cooler here for Thursday. Dry conditions warming to the weekend to the mid-80s with our next storm chance coming by next Tuesday.
Changing every day, but we're here with you. Continuous COVID-19 coverage during prime time. We're committed to giving you facts, not fear. On 11 Alive News Primetime, weeknights from 8 to 11 on WATF.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Today at noon on 11 Alive.
We are seeing that lack of smell or altered taste can be a symptom.
We answer your coronavirus-related medical questions. Because 11 Alive is where Atlanta speaks.
Televised newscasts not enough for you? Get even more at 11 Alive's YouTube channel, where you'll find uncut interviews, extended body cam footage, live streams of Atlanta's biggest trials, and more. Subscribe to 11 Alive today.
In times of great uncertainty, some things become more clear. The things we take for granted, the people we depend on daily. Here at 11 Alive, we'd like to say thank you. First responders, medical staff, sanitation workers, truck drivers, postal workers, and every brave Georgian doing their part to make a difference. We see you, we hear you, and we appreciate all that you do.
Let's start with a viral message going around. Quote, vast majority of people who died had ibuprofen Advil in their system. This message is fake.
We just bought 20 dust masks for $97.
Are you doing this to help people, or are you doing?
Empty parking lots no more. A popular Georgia mall is expected to open by Friday. New tonight, the challenge to get customers back inside. The point of no return. Some small business owners fear they won't ever be able to reopen their doors. New numbers tonight show a grim outlook. And the new metro Atlanta County becoming the next hotspot for COVID-19.